Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons. In that time, I've helped thousands of women in their surgical journey. My passion to educate and help women feel empowered is what led to what we now know as the Big Butts, No Lies podcast. Join in on the fun as I talk to plastic surgery experts, friends, and real life patients about all things plastic surgery. Should be fun. Hey guys, do I have the episode for you today? I've been telling you that I'm ready to get our toes wet with Botox and filler and facial rejuvenation, skincare. I'm ready. I'm ready to bring it on. So I brought some experts with me and you guys are in for a treat. I have Jen Pilot and Taylor Cooley, who are here from Lemon Plastic Surgery. You might know them from Instagram as The Plastic and P and Taylor the Laser Tech, but they're our experts today, and I am so excited to have them on. Thanks for joining me, guys.
Hello. Thanks for having us.
Hello.
I'm so excited to bring y'all on because Botox and filler is blowing up, isn't it? Wouldn't you guys agree? It's everywhere. Everybody's talking about it. Everybody's doing it, even though they might not say they're doing it, but they are.
Definitely.
Everyone's getting Botox and filler these days just to stay fresh and young and confident and really feeling themselves.
Yeah. So I wanted to, for our listeners, this is going to be our first time talking about it. And like previous episodes, when I start talking about a subject, I want to start at the basics. Like, let's pretend I'm a brand new patient and I have no clue what any of this stuff is. And you're going to educate me and educate our listeners, educate me, educate all of us on how we can stay looking young forever. Okay, so the first thing I think we should talk about, because I'm sure you get this asked every day, what is the difference between Botox and filler?
Well, it's a pretty simple difference. So filler is self-explanatory. It fills. It adds volume to areas that need some volume or can look better with some volume. And Botox is not as self-explanatory. It is a botulinum toxin that is purified, and we use it to reduce the muscle movement that causes repetitive crinkling in the skin, leading to wrinkles. So Botox helps wrinkles that are caused by repetitive motion, like the ones around your eyes and on your forehead and in between your brows. And filler helps to fill areas that can use a little bit more volume.
So filler and Botox, most of the time, although sometimes they do, they usually don't go in the same areas, right?
Right. I think that's pretty accurate. Botox is traditionally used for the upper part of the face, your forehead wrinkles, your frown lines, your crow's feet, although there's lots of off-label sort of advanced Botox that you can get all over your face, neck, back, calves, everywhere. And then filler is traditionally used for the lower 2/3 of the face, anywhere from the temples, the nose, the cheeks, the lips, the chin, jawline, neck wrinkles. So yeah, I'd say they're used in somewhat different areas.
That's right. So Jen, if I'm your patient, it's my first time coming in and I have a budget. We all have a budget when nobody has an open wallet walking in. Although some of us wish we did. We don't. We're on a budget. If a patient is price conscious, which one do you think they should focus on first?
I think you should treat your major signs of aging. So, and that's different for every face and every person, every body. So the signs of aging that are affecting you I think, should be priority. And that's how you're really going to make the most impact with the budget that you have. If you have great lips already, but you have some wrinkles on your forehead, let's do some Botox instead of lip filler. Or you have a deficient chin, but you have no wrinkles, let's do some chin filler and really optimize your facial features that are unique to you.
I love that. I actually saw one of your posts on Instagram and it was talking about how I really don't watch a lot of TV, so I don't know who that celebrity is.
Oh.
That her chin is kind of...
Yes, she is from, oh my gosh, I can't remember, The Queen's Gambit. And I think it was a Netflix series. It was a great Netflix series. And she's a beautiful person and beautiful actress. And I was watching it and I couldn't help but think like, oh my God, I just want to fill her chin. Like my little injector brain was like, I just want to fill her chin the entire time. Like her proportions are off. But sometimes proportions that aren't completely balanced or completely symmetrical are beautiful. So I hope she never fills her chin because she looks so unique and pretty the way that she is. But, in my head, I'm like, I balance everything and that's my job. That's what I do. So I wanted to fill her chin so bad. So I did it on Photoshop and I didn't love it.
I know. I loved her before. I loved her natural look is just gorgeous. It's perfect for her.
Me too. And there's one good thing about using hyaluronic acid gel filler, the kind that you can reverse, is that if you don't love something, you can reverse it. You have to be careful with more permanent fillers. They're non-reversible. But if you go with a hyaluronic acid gel filler, you're going to be able to reverse it. It's got a much safer safety profile. And, if for some reason, if you make the wrong choice or your injector and you make the wrong choice, you could reverse it.
I 100%. If this is your first time doing filler, and I've heard horror stories of patients having Artifill, the first time they've ever getting their face injected.
Mm-hmm.
And it's permanent. Well, semi-permanent or,
it's a long lasting.
It's a long lasting filler. So for our listeners who don't know really a lot about the different types of fillers, Jen, can you go through like the different types of fillers and where you would use them on a face?
Sure. I use a lot of hyaluronic acid gel fillers. So that's the ones you hear on commercials like Juvederm, Restylane, RHA, Versa, Bellatero. There's so many names, it's hard for even injectors who are first starting out to keep them all straight. So as a patient, not your job. You don't have to know them all. So don't feel intimidated by that. But the main category is a reversible gel filler, which is hyaluronic acid. There's another category, which is Radiesse or calcium hydroxyapatite. That one is not reversible, but isn't as long lasting as something like Artifill or what used to be called Bellafill. There are biostimulators like Sculptra.
My favorite product ever.
Mine too. I love Sculptra. And that one stimulates your own collagen. So it's not reversible, but it's very subtle and very, very pretty. I love it. Basically, anyone in their 30s, I think you should start getting a little bit of Sculptra and you will love yourself for it in your 40s. And then we have silicone, which you can have implanted in an implant, or injectable silicone, which is not very much in fashion anymore, not done quite often.
Is injectable silicone legal here?
I know that it used to be very recently by surgeons, but not by a non-medical professional. But I don't know if as of very recently, if it's still legal or not.
I hope
know
not.
That injectable silicone is not considered very safe. It can move. And you definitely, there are some surgeons who inject it in the lips. My feelings on that are mixed. I don't love the idea of it. I think if you want to go a very safe route, you want to stick to a hyaluronic acid gel filler. And that is your Juvederms, your Restylane, your Versas, and your RHAs.
Which, even though they're the same type of product, they all have different uses. They all have different, like, for example, the brand Allergan has a whole bunch of different filler types underneath, their Allergan brand. So, for example, they have a thicker product that you use for more lifting, right? Or
yeah,
you tell me.
Yeah, you're absolutely right. There, the way that hyaluronic acid is made and cross-linked and manufactured is important to how it behaves. That's called the rheology of hyaluronic acid gel filler. And if you want this podcast to last about 5 hours, we can go into all of it. But yeah, there's some different features about filler, like whether it stays kind of clumped together when it's in the skin, or whether it kind of spreads apart, whether it's cross-linked, how much water affinity it has, so how much water it grabs and is puffy, versus if it's kind of just stays how you put it, how flexible it is, how much strength it has under pressure. Like there's so many ways to measure HA filler. It gets very confusing.
It gets very confusing, but for the most part, your injector's going to know which product to use on which part of your face.
Your good injector is going to know. Yes, absolutely.
A good injector. So one of the reasons why I really liked Jen to come on and be our expert in P is because she is affiliated with her plastic surgery practice. And I think that's something that is important. I know a lot of nurse injectors or nurse practitioners or aesthetic nurse injectors don't have them on site. And so Jen, why don't you tell me, how is it having your surgeon on site?
I mean, it's great. So if you think about it as an injector, whether you're a physician assistant, an MD, a nurse or a nurse practitioner, if all you have is a hammer, then everybody's going to be a nail, right? So if you don't have the widest variety of anti-aging procedures available, you're limiting yourself to the options that, someone might push on you that might not be completely appropriate for you. So I think that in order to get the best, most natural, and most effective treatments, you have to go to a facility that has the widest range. So I think that's a plastic surgery center with a laser center inside of it and injectables. I think you can't get much wider than that. The second part of that is you have a safety net in that surgeon who understands injectables as well as how to treat complications. And your injector should too, but
there's nothing like that ace in your back pocket of having, your surgeon down the hall.
Yeah, exactly. I don't think that I would provide the variety of services that I do, like nose filler, which can be more risky and one of the top areas that causes blindness, irreversible blindness from injectables there, if I didn't have that, as you say, ace in my back pocket, right? Like if I wasn't at a place where I felt supported and had a second opinion that I valued, I wouldn't do it. Unfortunately, I don't think everyone makes those kind of decisions in their careers. And you might get yourself in a big pickle if you're in somebody's house or at a Botox party or in a hair salon, getting these aesthetic procedures that do have real complications, rare, but real, and can affect your life and sometimes even your livelihood.
Absolutely. So what are some of the safety measures you take when you are doing an injectable on a patient? I have a list right here written down of what I've seen on your page, but let's see.
So the first safety measure I take is to educate myself. And I say that because it's not as easy as an injector just to go to a training program and be completely educated. You have to have a very well-versed understanding of vascular anatomy for the face. And that's the first thing I do. So the second thing I do is I take measures like understanding that what are riskier injectable techniques versus less risk. So big boluses with high pressure, I avoid those. I always aspirate.
Which you would be, well, I'm sure you're not. I'm sure you've seen videos where the injector is not aspirating, and I just can't believe it.
Yeah, and there's a place and a time to aspirate and not aspirate. So I think that you're doing a technique that is, you're moving your needle around all the time. Like, why would you aspirate, right? Because you're going to be in a different spot in 0.5 seconds, right? So there's a reason to aspirate. And we're getting into the very technical part of injecting. But the safety measures I do are tailored to every area, every type of filler I'm injecting, and the patient. So I utilize ultrasound in higher risk techniques that I'm unsure of the vascular variability. So sometimes there's some thoughts of where the vessel is 80% of the time, but 20% of the time it's somewhere else, or it's where you don't want it to be. So I take my ultrasound and I take a peek. I just visualize the vessel, make sure it's where I think it's going to be or where I want it to be while I'm doing that technique, and I do that. Otherwise, I modify my technique and do it differently. Or sometimes I don't do it at all. So I always visualize the vessels in the nose right on the bridge. And if there's a vessel there, a big one, or one that I don't really want
to get close to,
seems like in my way, I don't inject.
The
And I might have
ultrasound,
just not blinded that patient.
which is A plus. Actually, ultrasound for injectables is fairly new. I mean, we didn't have those little ultrasound machines 10 years ago doing not at all.
The technology is new, and we can visualize vessels that are small, like facial investments, much easier and at an affordable scale for injectors. It's not a skill that's easy. There's a learning curve. Fortunately, I have had some experience with ultrasound in my nursing career, so I picked it up pretty quickly and can utilize it just as a pre-procedure kind of check to make sure that the procedure that I want to do is safe and the technique I want to do is safe for that patient. Because, none of us have X-ray vision. We can't see under the skin. And there is a lot of variability when it comes to your vascular anatomy. So my vessel in one place may be different than Taylor's. And that's just how we were made. The last thing I do is I'm always looking at the skin and I'm always asking how the patient feels. If there's a lot of pain involved, you might be in some trouble because a lot of the vessels run very closely with nerves. And so if you're hitting a vessel, it might be very painful for that patient. And so paying attention to your patient's comfort level and the look of their skin is very important, as well as the look of the actual procedure. You want the procedure to look good. So there's a lot to think about and there's a lot to pay attention to as an injector. So you really want to go to someone who's got some experience behind them to be able to handle all of that at one time for you.
100% agree. Okay, so now let's move on to this little topic, change of topic, prevention versus treatment. So here's where I love that we have Taylor on because Taylor helps on the prevention side. So Taylor, why don't you tell us a little bit of, for example, I'm a first-time patient coming in. I want to start getting my glow up on. So what should I do? I haven't had anything ever before. You're barely getting me on a skincare regimen. So let's take me back to that step.
Yeah, absolutely. I mean, I have so many patients that are so young and they come in and they come in for just a Hydrafacial but they're interested in something more, or maybe they're kind of curious. I get asked so many times like, hey, do you think I need Botox? Am I ready for it? And I'm like, that's definitely a question for an injector, but if a good option is to start with maybe a light laser or start with light facials or something like that. If I'm doing something to somebody to stimulate collagen, and their collagen stays nice and stimulated and plumps the skin and helps to soften fine lines and wrinkles, then maybe that will get them through a little bit to where they don't need Botox right away, or maybe they don't need as much. So if I'm doing that to help soften those fine lines and wrinkles, and maybe they don't need Botox yet, that would be a great first step for a patient who is younger and maybe just is not ready for that. Same thing like what you said with skincare. Starting a patient off with a good skincare routine, kind of based and tailored to their needs, whether it's acneic issues or, just being dry or pigmentation or anything, just getting them set up with a good skincare routine.
So tell us the difference between a Hydrafacial and let's say like a light peel or like a light, because these are questions I get and patients are comparing these types of things. And what I want is for us to educate our listeners, so they know, they understand what they're talking about when they're looking at peels and they're looking at Hydrafacials, and can the Hydrafacial really do any skin lightening like a peel can, and those types of questions.
Right. I mean, first things first, I love a good Hydrafacial. I think anybody can benefit from a Hydrafacial. It's a very superficial treatment. It doesn't matter if you're 18 years old or if you're 40 years old. Anybody can benefit from a Hydrafacial. It gets the top layer of dead skin cells off. It sucks everything out of the pores. It helps. Yeah, everything. Awesome. Smooths over any rough texture. Hydrates the skin and gives you this nice glow. So, your makeup goes on smoother. Your skincare penetrates deeper. So anybody could benefit from it. Is it going to tighten your skin? No. Is it going to get rid of pigmentation or sunspots or melasma? No. That's something that I would go to laser for, or I would go to Gen for, or I would even consider microneedling or maybe a chemical peel for. So it's going to be just a very superficial treatment that it's in the name. Think of it as just a facial.
Just a facial. So what should they if they're considering getting their toes wet with the skincare regimen. You'd be shocked at how many people don't have a skincare regimen at all. They're just, washing their face with what they get at the grocery store.
Absolutely. And I get that all the time. I have so many consultations that come in and they're like, I want to get rid of all these wrinkles and I want to get rid of all these spots and melasma and all this stuff. And I'm like, okay, well, hold on. Let's go back a little bit. Have you done anything in the past? No. I'm like, okay, we're in your 40s. Let's go back. What are you doing at home? What's your skincare regimen? And they're like, oh, well, I just use this moisturizer. I'm like, no cleanser, no, antioxidant, no retinol, no sunscreen. I'm like, okay, let's tailor the skincare routine a little bit. And, I like to keep skincare routines simple. I think if somebody is given a 17-step skincare routine that they have to do morning and night, they're not going to do it. And it's
100%. Because I can barely get myself to do what I have. 3-4 steps.
Exactly. I'm like, I have so many things sitting in my bathroom right now, and half of them I haven't even touched because I want something simple.
Yeah,
so,
the best skincare regimen is the one that you use.
Exactly. I say the same thing about sunscreen. Everybody's like, what's the best sunscreen? What's the best thing that's going to keep my collagen intact and my elastin fibers intact? I'm like, the best sunscreen is the one that you're going to use, whatever you will use. So I like a good gentle cleanser in the morning, and I like a exfoliating cleanser at night. Something with glycolic acid, salicylic acid, something like that. I like an antioxidant in the morning, and I like a moisturizer morning and night, and a sunscreen. That's typically what I set out for everybody. Obviously, everybody's going to be a little different. If you have pigmentation issues, we might throw in a retinol, or we might throw in something with kojic acid, or, some bleaching agent of some kind. But the best skincare routine is going to be something that's simple, something that you're going to do.
I think that it can be so customizable. I have three ingredients are 3 skincare steps that I ask everybody to use once they get into the aging phase of their life. So, and I think that's 30s on. Mm-hmm. And it's a vitamin C in the morning, a retinol or a retin-A at night. And I prescribe a prescription retin-A for a lot of my patients, and then a sunscreen.
Yep.
And, if you can start there, you're on a really good track.
Absolutely.
Once we get into pigmentation and acne, it's a whole different story, and it has to be super customized. And you can come to us at Lemon Avenue and get a super customized routine. But if you can start with those 3 things, you're going to be much better off than using just some random soap at the grocery store.
Absolutely. You're setting yourself up for success with those 3 products right there.
So that's my skincare regimen right now. I have a little sprinkle here and there of additives for like my hyperpigmentation, but pretty much I keep it simple because I get lazy and I will not do it.
Girl, me too.
We all do. I mean, even people in the industry, we do it all the time.
Yeah, we really do. I'm sure you two have the same of cabinets full of different products after product after product after product that you use maybe once because you're trying it out, and then you're like, no, it's not really for me.
Yeah, there's things that I'll try. I mean, you can get more complicated with your skincare, and there's things that are effective, but maybe not as effective as other products. Like peptides are showing some nice efficacy, but maybe not as effective as a retinol. So if you're only going to use 3 things, use a retinol. Don't waste your time with a peptide. Like, use what's most effective, most well documented. After a procedure like lasers or microneedling, I'd like to use a growth factor for 6 weeks or so. But that's where you can really rely on your experts, your injectors, your skincare professionals, your laser techs, that they can tell you those little tips and tricks to optimize your skin, to optimize your procedures, and look and feel your best.
Absolutely. So one of the things that I want to point out, and you've kind of mentioned it earlier, was about if you only have a hammer, everybody's going to be a nail. And I think that is perfectly said because it's very true. And I've talked about it before as, when I talk about a surgeon's toolbox, and I'm telling you guys, some surgeons have J-plasma or Renuvion in their toolbox and others don't. And that's just how it is. And it's okay. So when you're picking your expert, when you're picking your injector, when you're picking your esthetician or your laser rep, you want to see that there's a bunch of other stuff. Like, for example, there's an injector, there's a spa, there's an esthetician. So they're tackling aging from multiple directions. And that way they will really look at your skin and look at the whole toolbox. Because, for example, Jen knows what Taylor has in his toolbox. She might not know how to use it or everything about it, but she knows, hey, he has something in his toolbox that could benefit you. And just like that, Taylor knows what Jen has in her toolbox, and he can send the patient to Jen. It takes a village. It really does. Because you have your person taking care of your skin. You have your surgeon taking care of your body, and then you have your injector taking care of your face. And when they all work together, it's like a harmony.
It really is. And none of this stuff is an emergency, right? Like, and you don't have to do any of this. But my patients who see the best results and who look and really are the most confident with themselves, like the real glow up, are the ones that do multimodality treatments. It's the ones that I'm like, hey, you've got a little bit of sun damage on your face. Like, why don't you think about a yearly laser? Or, that's really going to help you have a clearer complexion. And let's get rid of some of that sun damage and keep your skin in a really good, healthy condition. Or the ones that have jowling that, if I pump more filler in there, it's not going to do them any favors. Like, they really need to consider a facelift. So I ask them, like, do a facelift consultation. It's free. Think about it. Explore the option. Everybody hates that word. They're like, oh my God, my injector told me I need a facelift. I did not. I just want you to explore it and think about it and see if that's maybe the right route for you to go. And one example that I really love to use is the Kybella versus lipo under the chin. I love Kybella. And I was just told that we're one of the top 10 accounts in the United States for Kybella use. I don't understand how.
Wow, really? Because
but we use it, and I utilize it in an off-label way that I really enjoy and I really like. I don't use it so much under the chin. I think that it works okay. It gets rid of some fat, but nobody's happy with that anymore. Everybody wants that snatched jawline. So if I understand that, that's what I want too. So I ask my patients to explore the option of lipo under their chin. It's effective. It's about the same cost, if not less expensive than 5 rounds of Kybella. And it's done in one treatment and they suck it right out. But somehow I still use a lot of Kybella in other ways.
Oh, I hope I'm going to send you a picture of a little spot on my face that I think if I just had a little bit of Kybella there, maybe it could make that little, those smile lines. I'm getting smile lines. I smile because I smile all the time and I'm smiling all the time. And I'm getting these smile lines that are starting to bother me.
Yeah, I love Kybella, like in the jowl area for people who have a very big superficial fat pad there. And I reduce it just a little bit. I use a small amount, less than I've seen in any of the articles written. And it works really well. And you can't get rid of all that fat there, because if you get rid of all of it, you're going to have wrinkles. But I love that Kybella is just effective enough to reduce the volume there. And it looks really good.
And you get really good results with it.
Yeah, I get pretty good results with that.
That's really interesting that you get such great results, because I had Kybella in my last episode with Dr. Grunberg, we were talking about this. I had Kybella and she did have Kybella in her chin as well. Mm-hmm. And the reduction was so minimal, we ended up having chin lipo anyway.
Yeah, a lot of patients see that. And I don't do Kybella under the chin very much because you have to match the treatment with the expectation. Uh-huh. And nobody wants just a little bit of fat removed under their chin. They want it all gone.
All of it. Every single drop.
Just suck it out. Like there's no need to mess around with Kybella. I rarely ever do Kybella there.
Just go to lipo.
Yeah, straight to lipo. And our surgeon does it. And but if you went to somewhere that doesn't have a surgeon, you might spin your wheels doing Kybella or doing a service that isn't going to get you the results that you want. So you have to be very clear with your expectations and very clear, you know what you want, and ask the provider, what is this going to do? Is this going to get rid of all of it or 20% of it? And understand that. Understand the difference.
That's a great question to ask in a consultation. Absolutely. There's so many.
What is this realistically going to do?
Right. Then there's so many times, like, and I know Jen does the same thing. If somebody you can tell is just asking for, asking for the moon and stars, I will tell them, hey, look, if I get you back here in a month and we take a look at your results and I see a 25-30% reduction in fine lines or 20 and 30% reduction in melasma and sunspots, I'm going to consider that a successful treatment.
Mm-hmm.
And to them, they're thinking in their head 100% of fine lines and wrinkles are gone. That's a successful treatment to them. So that's a really great question to ask for anybody who's listening. If you're going in for a consultation, hey, is this Kybella going to get 20% of my fat gone or 100%? Like,
how much of it's actually going to go? And I think that's a really good question for any treatment. For anything that you're doing.
Realize that although these things might be expensive, we utilize the technology that is out there right now. Mm-hmm. And none of it is a magic wand.
Right.
So we utilize the best things that we have to get you the best results that we can get. But you need to understand what those results really mean. And we all have, everyone's set up with expectations for what these procedures can do. So any injector should be able to tell you, well, this is going to remove about, on average, this and this and this. They all know what it's going to do. And those are the questions you can definitely ask. So is it worth it to spend $6,000 on Kybella when you could just go get it sucked out? To me, no. Most of the time.
No.
If you're a good candidate for lipo, no. If you're not a good candidate for lipo, you can't go under surgery, can't go under general, or for some reason it's not a good option for you, then maybe you think about Kybella or something like cool sculpting. But that's why I think it's really important to go to somewhere that has more than just a hammer in their toolbox. Like go to somewhere that's got a screwdriver and a drill or something.
Yeah, a screwdriver, a drill. They have all the works, because sometimes I'm shocked when I see a before and after picture, and the before picture is somebody who needed a facelift. Yeah. And then the after, it's like after 12 syringes of filler. And I'm thinking in my head, like, how did you guys just waste this lady's money like that?
Yeah.
I really do feel like that. And I mean, I hope, lady, that you have a lot more, but in case you don't, I really wish they wouldn't have spent your money like that, because it's better for you to just save it and get the facelift.
I ran across a case today, and she last year had $9,000 worth of filler in her face.
Can you believe that? Like, that's shocking to me.
You cannot tell today that she had filler in her face. Like,
she ate through it.
No, I don't know. I'm not sure, but she needed a facelift, and she probably needed a facelift a year ago. So, a facelift will run you around 10, 20, some celebrity person, 85, right? But it's ridiculous.
100.
Yeah. But, a good deep plane facelift is not that much more than $9,000 worth of filler. So in order to get a really pretty natural result, I think she would have been better served with a facelift. And that's what I told her today. Instead of pumping another $4,000, $5,000 worth of filler, I want you to explore this option of maybe pulling back and cutting your skin. And that's going to last you, 10 years. And then slightly filling your face with a couple $1,000s worth of filler. But that's the kind of experience that you get with really trusted providers. And I don't know how to gauge that. I don't know how to tell you who's a trusted provider or not, but some key things you can look for are experience, good results, honesty, the ability to tell you no, and a wide variety of treatments at their disposal.
Yeah, I think honesty and the ability to tell you no speaks volumes.
So much.
Especially that patient you were talking about, yesterday or today. Like, had that injector just been honest and, said, hey, I think you need a facelift. And while that might have been hard for that patient to hear, they would eventually. Yeah, it's never easy to hear. But, that patient goes home and thinks about it and is like, wow, this person didn't just take my money and just fill me up just so you can
fill up their pockets.
Exactly.
And
it's honesty.
It's honesty. It's ethics. It's really ethics. And I think
no one posts about that on their profile, right? Like, I'm an honest, ethical provider.
Right.
But I think you can tell by some of the things that they post. And I think the ability to say no is, if someone tells you no, it's probably for a really good reason.
Yep.
And you can probably count that person as an honest injector, or honest laser tech, or an honest plastic surgeon. Some of my only 1-star reviews are people I've never treated, and I told no.
And they get upset and offended.
Yeah, offended. Yeah. And, it's like, why won't you treat me? Because you don't like me? No, that's not it at all. Like, it's because I want to do the best thing for you.
Right.
In my eyes.
If you're going for a look that is not your aesthetic, then you're not the injector for them.
Perfect. Yeah.
Yeah.
And that's okay.
Yeah, and that's okay. There's maybe an injector out there that is for you. It's funny you had that happen yesterday. I literally had the same thing happen yesterday where a patient came in and we were treating her acne, and I had done a few laser treatments on her for her acne, and she came in yesterday for a follow-up expecting to do another one, and I was like, hey, look, your skin looks great. Like, there's nothing to correct anymore. Your skincare regimen is working. I say, let's get some after photos, and there's no need to do a treatment today. And she was very quiet, and I was like, save you some money, blah, blah, blah. We don't have to do anything today. And I thought she was kind of like upset that she wasn't getting a treatment today, or like she felt like I just didn't want to do it, or I don't know what it was. And then a few hours later, she shot me a text message and said, hey, thank you so much for being so honest about not just taking my money and doing a treatment on me. That, I really appreciate that. I'm so happy I have you in my life. I'm like, okay, cool. Like,
I love that. I love that. Taylor, you rock. That's exactly what I like to hear. You guys, see, this is why they're on. This is why they're on here today. Because I want my listeners to know that these are the type of people that you should be looking for to do your treatments, to be your providers, ethical, people who will turn you down when you're asking for too much. Because let me tell you, more filler is not always the answer. More is not always what you need. Sometimes you need something different. And for your provider to be able to guide you in that direction, like, hey, let me move your arrow just a tiny little bit to the right. Okay, now we're going to do this. Well, when we're done with this, we'll handle this. And it's, it's a work in progress.
Absolutely.
All of it is a work in progress. But before we end our episode, I have one more question. And this question is I get asked this question every day about filler migration in the lips. Why does it happen?
I have a complicated answer for you, but the main reason why it happens is overfilling your lip capacity. So, and everyone's lip capacity is different. Some people come in with nice big lips with loose lip tissue, and they can take a lot of filler. Think of it like a deflated balloon, a big deflated balloon. Yeah, I can put a lot of filler in those lips, and I can make them look really good and really big and really juicy and beautiful, and it's never going to migrate because there's lots of room in there. But if you come in with tight, small lips and you expect to have a much bigger lip and you keep going to an injector who's going to keep filling, there's no border of your lips inside your tissue. There's no stopping point where it's just going to stop it from going up. It's going to go up, and
it's got to go somewhere.
It's got to go somewhere. And your mouth is the second place on your face that moves the most. You're always talking. Your eyes are always blinking, so that's the first. But you're moving your mouth so often to breathe and talk and eat and smile. And it's so dynamic that the filler is going to move if it's overfilled. I think
beautiful answer.
Thank you. I think the second reason is product choice. I think my own opinion, there's some fillers that are too puffy for the upper lip, some upper lips, and there are ones that create a really thick border that looks like migration. But it goes back to your injector being able to tell you, no, honey, you can't get those lips, and it wouldn't look good on you, and you don't need them, and helps you not only tell you no, but helps you feel confident in your own features, because that's what this is all about. That's why you're going to an injector. That's why you're wanting to enhance your look, is to feel confident and perform your best in life and to be happy. And no one needs to hyper focus on their lips necessarily. I wish less people filled their lips because I don't think it's necessary. But
I think it's like anything. It's that we go through these trends.
Yes.
There was a while, I don't even remember the year, maybe 2010, where there was big apple cheeks were a trend. And there's been other trends. There's been big chins. There's been super, super sculpted jawlines that when online and the pictures look great, but then when you actually see them in person, their face looks just very square and very wide. And it's just one of those trends that comes and goes. So I think lips right now, lips and butts are getting the highlight, are getting the
Yeah, I can see that.
spotlight.
I think you have to look at what you're comparing yourself to. And I always ask for photos. And, someone will bring me a photo of, this photo I know I've seen before. Everyone references it, of one side of someone's face, lateral view of their really sharp jawline the day they got inducted. Let's look at this person maybe 3 months later from the front and see what she looks like. Like, there's so many other aspects to life than a one before and after Instagram photo. And I look at my patients when they talk and when they move and what muscles they use and what features that are really impactful to their unique appearance and their beauty that I want to enhance and those that I want to leave alone. And I think that's really what matters. I mean, real life matters. As much as your photos and your selfies matter to you, I think that the way that you interact with people and see people really matters. So it hurts me to see people who come in with these overfilled tear troughs and these overprojected lips and these cheeks that just stick out like velociraptors. And it's horrible. And I think that these things can impact your life in so many more ways than you consider. I think that it can impact your ability to get a job. I think it impact the friends that you have and the way that people interact with you. Maybe it can impact the partner that you get. So your injector really matters. And there's more ethical components to injecting than I think is portrayed. But if you pick someone who can tell you no, I think you're on a really good track.
Absolutely. And so we're here in Texas. We have a lot of listeners around the country and actually around the world. Hey, guys. But here in Texas, who is allowed to inject?
Anybody.
No way.
Not anybody.
Not anybody. No.
Anybody with under a physician's delegation is allowed to inject in Texas. So that means a physician says that you are proficient in this skill and I delegate you to perform this procedure either under direct supervision, I'm in the office, or indirect supervision. And that depends on their licensing level. And I think that you should go to a nurse to be injected at the very least. I think that they should have their RN or LVN. Ideally, you should go to someone in a plastic surgery office. I'm biased to that. Or maybe a dermatology office. Someone with a physician on site who is also understands these procedures and can deal with the complications. I think some people get in trouble when they go to someone who's not a nurse, say a layperson or an esthetician who has an ER physician that is not on site but working in the hospital over there and doesn't really know these procedures, and something happens and then no one knows how to fix it.
Nobody knows what to do to treat the complication. And I've actually seen that. I went to have a facial a few weeks ago, and then my esthetician, Raquel, hey Raquel, she was telling me about one of her friends actually that had her lips done at I guess you can call it a injector office. The physician was within the 15-mile radius, I think is what she told me. Like, he had to be within the 15-mile radius, but he was an ER doctor and he really didn't understand what he was looking at when he was looking at the occlusion. And yes. And
I'll tell you that
he couldn't see it.
Quite literally the physician's liability to understand how to treat those procedures. If he's delegating a procedure to someone, it's his responsibility or her to understand how to treat them. And so any physicians listening, please go to some courses and understand how to treat them. I have heard of 3 cases in the last week or 2 of even nurses who couldn't clear a vascular occlusion and wanted potentially my help with ultrasound to help clear it. So this is not an easy thing to do, and these things do happen.
They have to be prepared. These complications happen. And I always tell you guys, complications can happen. And we prepare ourselves and we set ourselves up for success by knowing that whoever we are allowing to treat us can handle the complication that could come their way.
Mm-hmm. I think that's good advice.
And I talk about it with the plastic surgeons. Y'all know in past episodes, we've talked about the board certified plastic surgeon versus cosmetic surgeon and all of that. Y'all have heard experts, Dr. Azizi. Y'all are going to hear from Dr. Macias in a future episode about this specific, like how to handle complications from cosmetic procedures that are being done. So great episode. I think we have done a great job. What do y'all think before we leave on this episode? Taylor, if your best friend is about to start her glow up journey, what would be your piece of advice for her?
Oh, man.
You're next gen, so think about it.
If it's one piece of advice, and I feel like so many people roll their eyes at me when I say this and they think, really, that's it? But it really does make a world of a difference if you do this every day. Wear sunscreen.
Yeah.
Put it on in the morning. I literally put my sunscreen on in the morning. I drive to work. I stay inside the office all day. But you know what? The first thing I do is when I get back in my car and I drive back home, I reapply. You know, my friends roll their eyes at me all day long. And I'm like, you know, we're out and about. We were literally in California last month and we're hiking, and I'm literally the annoying person asking, hey, do you need sunscreen? Hey, did you put on sunscreen? Hey, and they're all like, oh my God. I'm like, no, look, keep your elastin fibers strong. Keep your collagen production going. Keep your elasticity going. Like,
can you be my friend? I need you to hang out with me.
Like, I'm the crazy mom at the beach that's just grabbing sunscreen and putting it on random people's faces. Like,
you should see our pool parties. It's like we're making reels of us putting on sunscreen.
Literally, like, it's the most simple thing in the world, and everybody has access to it. You don't have to go to an expensive skincare store or plastic surgery office to get sunscreen and put it on your face. Everybody has access to it. It's the best thing you can do. Absolutely.
I 100% agree. Y'all know I talk about it all the time. Put your sunscreen on your hands, on your neck, on your chest, on your face.
Yes.
Yeah.
Okay, Jen. Now, what about you? If it was your best friend, what piece of advice do you have for her?
I mean, you can't really beat sunscreen. I love a good hat too, but I think, my advice is to not hyper focus on yourself and flaws that you have, and as you age, don't narrow in and microscopically examine like every little wrinkle. Enjoy the process. This is your one life, and you want to feel confident in yourself. And if you need a treatment and you want something to feel better about yourself, do it. Just do it. Don't worry about other people, what they say, what they think.
Do it for yourself.
Things that make you happy, and do it for yourself.
Yeah, I love that.
I love that. I think that's the perfect note to end the episode on. I love it.
Stay away from magnifying mirrors.
Yes. Put away the 10x mirror.
Only when you're putting on some brow gel or like a wing eye.
Yeah.
You need it.
I love it. So Taylor and Jen, tell our listeners where they can find you guys.
I'm on Instagram. The best place to see my work is on Instagram, The Plastic NP. And you can find me at Lemon Avenue Plastic Surgery Center in Dallas.
Same. You can find me at Lemon Avenue Plastic Surgery Center in Dallas. And my Instagram is LaserTechTaylor. I always post a lot of before and afters, just like Jen does. Best place you can find me and asking me any questions.
Yes. So y'all already know where you can go chat them up, ask for a consultation, maybe get a regimen started. Y'all know where to go. I'll see you guys.
Thank you so much for having us.
Thank you.
Thank y'all. I love it. Y'all are going to have to come back. Tomorrow we have another episode. This is just today. Tomorrow we're recording with Taylor, and it's going to be all about laser and skincare.
Woohoo. Yay.
Yay. Can't wait. All right. I'll talk to y'all tomorrow.
All right.
Bye.
Bye.
I would like to end this episode with a huge thank you to all of our listeners. If you enjoyed this podcast, make sure to subscribe to Big Butts No Lies Podcast and follow us on Instagram at Big Butts No Lies Podcast. If you have a topic you want me to cover, please send it to the DMs. If you know anyone on their plastic surgery journey, be sure to recommend them the show. You can also visit us on our website, bigbuttsnolies.com. You'll see the online surgical recovery store. We're adding new items all the time. If there's something you think I need to have on there, send me a DM. Don't forget to leave us a 5-star rating on Apple Podcasts. And don't forget, new episodes every Monday. I'll see you then.